So today we're going to talk about obstructive sleep apnea and CPAP. So when we're talking to our patients, we want to explain to them that when we go to sleep, all the muscles in our body relax. And we also have muscles here in the upper airways, and our airway is a lot like a tube. So when we go to sleep and these muscles relax, they sort of relax on each other and constrict the airway, making it harder to breathe. And this causes what we call a sleep apnea. And what this is a complete cessation of breathing for at least 5 seconds. And to be diagnosed with OSA, you have to have at least 5 apneas per hour. And so when we think about that, that means that you stop breathing at least 5 times per hour during the night when you're asleep. And so that is very dangerous. It can lead to things like high blood pressure, heart disease, stroke, depression, and obesity if left untreated. Symptoms of OSA are excessive daytime sleepiness, memory loss, lack of concentration, even headaches in the morning. So what we want to do is explain the process of the treatment, and the most common treatment would be what we call CPAP therapy. And CPAP stands for continuous positive airway pressure. And what this means is because our airway is closing at night and constricting on itself, what we do is we fit our patients with a mask that's going to continually deliver a positive airway pressure. And it just starts out at a low pressure, and it's just going to increase through the night as needed. But the goal of the CPAP therapy is to provide enough pressure through the airway to inflate the airway and allow it to open up to be able to get air in and out. There are other treatment options though, such as dental devices and surgeries, but the CPAP therapy is a lot less invasive and is very successful in treating patients when they comply with their CPAP therapy. So what we'll do is, after our original PSG, if we've screened for apneas and we think that our patient will benefit from CPAP therapy, we're going to bring them in for a second night study to confirm it, and we're going to fit them with a CPAP mask known as a CPAP titration, and then we're going to go ahead and start them out with our lower pressures that the doctors give us, and we're going to increase it throughout the night until we determine what pressure the patient needs. There are a lot of different masks for the CPAP therapy, so we want to make sure that we go through each one and find the one that's most comfortable for our patient and their specific needs. And after we find a good mask, what we're going to do is we're going to send them over to a DME company where they'll get their equipment and learn how to use it and take care of it and everything like that. And we also want to tell our patients the reasons why they might have obstructive sleep apnea. It's more common in men than in women, and it can also be caused by obesity, large tonsils, or a large tongue. And your neck circumference has a lot to do with it, because the larger the neck, the more muscles that are in there to collapse and restrict as you fall asleep, and that's going to mean more constriction of the airway. And this is commonly seen in people who snore. So if anyone snores during the night, we should definitely be screening them for OSA. And it's important to just educate the patient on the risks of having OSA and leaving it untreated. Like I mentioned, there were heart disease, stroke, high blood pressure, all very serious conditions that can be treated simply by getting a better night's sleep.